welcome back to my channel. I'm Keely. I'm testing out my new mic. So I don't really know how far I have to be from it or anything. I guess I'll just have to see. Anyway, this is going to be Badger's mic because you guys know we have been sharing the boom mic for our reaction videos, like our music reaction videos, and I couldn't take it anymore. So I got her own microphone with my birthday money. I also got her a bed and a mattress and all kinds of cute stuff because we're gonna like make her room up like really hippie and cute. Anyway, so I just got out of the hospital. I was there for a little over a week and I have been having a really hard time recovering. My eyes look a little bit jaundiced. They were saying I had cirrhosis, but I just had a liver biopsy like not even a year ago and they didn't say shit about cirrhosis, and I don't drink or do drugs, so I don't know how the fuck I would end up with cirrhosis. I think what happened was they ended up having to drain a bunch of fluid from my abdomen. I actually lost like 30 pounds. You can't tell because of all the fluid in my face, but they drained a bunch of fluid from my stomach because of dialysis. I have kidney failure. And it was like pushing up into my liver, and they said my liver looked enlarged, and I think it was because of all of the fluid. I'm hoping. The jaundice in my eyes is kind of scaring me a little bit, so fingers crossed, guys. Hopefully I'm not. Oh, they also said my troponin levels in my heart were high, and it's common for people on dialysis to go into heart failure. So liver, heart failure, kidney failure, heart failure. Let's hope I just stick with the kidney failure one. Prayers, please. Good vibes, please. Whatever you believe in. I'll even take prayers at this point. Because I'm like really scared that I might be going into liver failure or heart failure or something. Because like, I mean, why wouldn't I have some major health anxiety problems after everything I've been through? And the hospital ruined my skin, so I've got my little stickers on. Okay, let's get to the point. This video is, I've known about this story for a long time. I actually think about this story constantly because I am a dialysis patient, and this is I think it's just like the body cam in the interrogation video of the woman who injected bleach into her dialysis patient's dialysis lines. It kind of made me nauseous to think about that. She injected bleach basically into the dialysis lines and killed her patients. And I was dating a guy who had been my dialysis tech, but he moved to a new company, so nobody freaking get mad. I brought this up. I was like, did you hear about the nurse who was injecting bleach into her patients' lines? And he goes, don't you hate seeing other people live out your dreams? He was a freaking psychopath, you guys. He was like American Psycho. He'd been to like Iraq or he had been to Afghanistan like freaking 5 times. He was like a combat medic, but he was psychotic. He was crazy. He was actually insane. And I was like, yeah, so you're in charge of patients. Cause he did home dialysis at that point. I was like, that's like a really disturbing that you're joking about killing patients. Like, that's not cool, especially since I'm a dialysis patient. Like, what the hell, dude? He was freaking crazy. I called him Patrick Bateman all the time. I don't think he got the reference. He was like not that smart. But anyway, we're gonna watch the body cam footage of the dialysis nurse who put bleach in her patient's lines, and I have a feeling I'm gonna get mad. And I'm going to get really like, this scares me because like you have to try. We're about to get a bunch of storms and the air is so dry in here. But like oh my God, my allergies are just terrible. Anyway, like these people are in charge of your life. Like I rely on these people to stay alive. You have to have a lot of trust with your dialysis team. And, yeah, that's just so sad because these people are going through like the biggest battle of their lives. Dialysis fucking sucks. I'm sorry. Dialysis is the worst. It's horrible. If I was old, I would tell them just forget it. Like, let me go peacefully because you have no quality of life with dialysis. It's literally terrible. I've never in my life This is like the worst thing I mean, besides losing my dad, this is the worst thing I've ever gone through in my entire life. And I've been doing it for 7 years because it's that hard to get on the transplant list. And it literally just annihilates every part of your body. I've had so many different surgeries for so many different things. I've been on so many different medications. My blood pressure in the hospital was like, it was like 240 over like 140 something. I'll have to put it up right here. It was real bad. I had perfect blood pressure before I started dialysis. Like, it sucks. It's just terrible. And like, I know why doctors always say if they were told they had to go on dialysis, they wouldn't do it. So these people are already going through like the biggest fight of their lives, and they're still fighting. And then they get killed by someone they trusted to keep them alive and help them in that fight. This just makes me so angry. So let's just go ahead and get started. Don't forget to like and subscribe. And yeah, let's just go ahead and get to the video. Yeah, okay. This was in 2008. Like, I specifically remember this. This makes me so mad. Okay, let's go.
Back in 2008, 2 patients claimed that they saw a 35-year-old...
Yep, there's the dialysis machines. That's kind of... Is that the same as mine? These are a little bit older, but it was 2008. We still have those frickin' TVs. Do you see these, like, boom arm things? Yeah, those are the TVs. Her fat head's in the way. Hold on, let's start it over so we can actually see it.
Back in 2008, 2...
See, these are the TVs, and ours are still these same TVs. They're like little flat screen type TVs. I hate it. I hate it. Everybody at my clinic just like blast Fox. They blast Fox News and Gunsmoke. That's like, I'm also the youngest person at my clinic, so I literally feel like I'm in a nursing home. It sucks so bad. Was this at a DaVita or a Fresenius? I think this is a DaVita. It looks like a DaVita.
Patients claim that they saw 35-year-old nurse Kimberly Sands draw bleach into a syringe and then inject the solution into the IV lines of 2 patients receiving dialysis. The patients immediately told the supervisor what they saw. Kimberly was sent home, and the supervisor called the police and told them what had happened.
Good.
So I went, and the first person I approached was Marlene Hamilton, and I grabbed a chair, sat.
So they saw her draw from the bleach jug because they have like a whole thing. They run the bleach through the dialysis machines and stuff. So there is a lot of bleach there. So someone apparently, I guess, saw her draw up the syringe from the bleach, because otherwise I don't know how they would be able to really know unless they were watching her put the meds together. I have to go back a minute. I have to see what they said. Sorry, guys.
Lines of 2 patients receiving dialysis. The patients immediately told the supervisor what...
I didn't go back far enough.
Lines of 2 patients receiving...
Oh my God, I didn't go back far enough.
35-year-old nurse Kimberly Sands draw bleach into a syringe and then inject the solution into the IV lines of 2 patients receiving dialysis. The patients immediately told the supervisor what they saw. Kimberly was sent home, and the supervisor...
So she must have been doing it from the bleach jug. If the patients were able to see her, she wasn't up at the nurse's station or anywhere where, like, she couldn't do it back in the frickin' the water room or anything. Kind of weird. Okay, let's move on. But apparently she was really that dumb about it, which I'm glad it got her caught. Okay.
The person I approached was Marlene Hamilton, and I grabbed a chair, sat down, got on her level, sat up close to her so I could have a private conversation and just reassure her what's going on, what can I do to help.
It's hard to have a private conversation in a dialysis clinic, trust me. You're literally just sitting out facing the wide open clinic with a bunch of patients around you. That's why you're not supposed to like record on your phone or anything or go live. You can't go live. I learned my lesson on that. I was in the back corner. Nobody was in the clinic. I was the last person there, and I still got in trouble because I was on TikTok Live just talking to a couple of my friends. It's like, I'm bored.
Help, and, what do you need to tell me? I understand you're upset. Miss Hamilton said, I cannot believe what I just saw. And I said, well, tell me what you saw earlier, what's going on. And she's like, I saw that nurse over there, the one with the ponytail, the one with Kim.
Is she a tech or a
nurse?
nurse?
Yes, Miss Kim Delvian. She says, yes. She goes, I saw her draw up some of that Clorox. She kept insisting that it was Clorox. I saw her drop that Clorox, and she went and injected it in that patient over there. And Miss Roan, I said, which one? And she said, Miss Roan's chair, she got sick a while ago too. And it wasn't long after she injected that. And I said, okay. And she said, and then she went and she put it in that sharps container over there.
This gives me like,
she didn't bring it,
It makes me, this made me
she
sick.
walked over there, and then she came back over here, and she kept really looking around, acting like she was real nervous. And she didn't bring it over here, but she walked way back over there and put the needle in that container. I said, okay, we're gonna be okay. You're gonna be okay. She will not come take you off. I'll get someone else over here to take
So
her.
she's a tech, I'm
I
assuming.
said, you okay? Yes, ma'am, I'm okay. I said, all right. So then I
Maybe
wheeled
she's a
over
nurse.
and I talked to Linda Hall. Miss Hall, let's go.
So you have your nurses, so you have like one nurse for every so many patients, and then you have your techs. And the techs have sections. And so I usually kind of almost always get the same techs. But the techs will put you on and take you off. The nurses will come by, check your heart rate, your breathing, ask if everything is, feeling okay, if you've had any like falls or anything, and then they will give you all your meds. Like they give me Benadryl, and they give me like some calcium meds, and they give me iron and stuff like that through my IV, through the dialysis like line, which is basically like an IV. But yeah, but the nurses at my clinic at least don't put people on and take them off unless they're so busy and like they literally can't get any other techs to do it. Usually the techs are the ones taking you on and off. So that's why I was confused, because the lady didn't say she wasn't a nurse. Sometimes some patients don't know like the difference. So I'm wondering if like nurses were taking people on and off at their clinic, or if she was a tech and not a nurse. I don't know. Maybe we'll find out.
Going on, what can I do? I understand you're upset. And she basically gave me the same story about Kim having a bleach container on the floor, and that Kim drew up bleach from that container and stood up with the syringe right by her side and just kept looking around, watching. And I said, well, what was she watching for? And she's like, because just curious. And she's like, well, she was waiting for Dale, who was my med nurse that day, to walk back from where he was at with Arlene, who was monitoring him. When he had left that area, that's when she had walked over to Miss Roan's area and actually had infused what she thought was bleach into the lines of the patient. And she gave the exact same story about how she came back over and was still hiding the syringe by her side, and then how she later had gone and disposed of the syringe in the sharps container. I reassured her as well, Kim will not be over here to take care of you. I will take care of this. You're going to be okay. Oh, and
She the administrator?
You're not going to believe me. That's not the case. I do believe you, and I will investigate this. It's going to be
She
okay.
must be the administrator. It's good when you have a good one.
Quietly walked off. At the time, Kim was not on the floor. She was on break. And I went and spoke with Kim outside. And I just asked her, Kim, have you given any meds today? Left it open-ended. She told me she hadn't. And I said, well, did you mix the containers for your clamps and bleach racks? And she said, well, I went and drew up some syringes of bleach and I was mixing my containers. And I said, you drew up bleach and syringes to measure out your bleach? And she said, yes, I did. And I said, don't we use the cup? She's like, well, this is my first time. She goes, I had the container on the floor and I was just making sure I had it all done correct. I was like, you had the container on the floor? We never put our containers on the floor. And she's like, well, yeah, I did.
The floors are gross there.
Okay. We don't do it that way, and that's not the way we're supposed to. And I said, but you've not given any meds.
If I ever drop anything at dialysis and it like it's like a lid for something, they're like, yeah, or like if it's like a water bottle, they'd be like, yeah, you don't want to drink that. Like anything that touches the floor at dialysis, it's fine. I'm done with it.
Nope, haven't given any meds. I said, okay, all right. So I come back in and trying to decide, where to go, what to do, could I justify what's going on? Because this is totally inappropriate, totally awkward, not dialysis practices.
Yeah.
So in the meantime, because I knew she was still outside, I went and grabbed the sharps container that was at the end, and I took it to the lab, just to get it off the floor so I would have it. I spoke to Giselle Fournette and just told her to watch that sharps container, not to let anybody buy it.
Good. This lady's doing a great job.
Okay. I knew that Kim was having a bad day from that morning, so I used that as my opportunity to go back and talk to her and just let her know that since you're having a bad day, to go home. When I was walking off the floor, I found Kim at the nurse's station around Yasmin's area. So I asked her to come where I was, and I just explained to her, you're having a bad day. Things just haven't gone from you from the get-go.
Yasmin must be a tech.
And so, and she's like, well, now they're telling me that the patients are saying that I put medicine or I drew up something and put in one of the patients.
They can't keep anything a secret, can they?
That just means you're having even a worse day. So you know what, why don't you go into the house? Because I just, you're having a bad day, we'll start again fresh in the morning and we'll do that. And she's like, that sounds great. And so she left my building. From there, I proceeded on.
She must be the administrator.
Running my sharps container.
She's good.
And I laid out blue pads, which are chuck pads. They're plastic on the bottom and cotton on top, so they're absorbent. And then I opened up the sharps container. Giselle had another sharps container with her that, from my knowledge, Yasmin had brought to her. So we opened up both the sharps containers.
I think I missed who Giselle was. Maybe she's one of the other techs.
In two different piles and poured them out. And there were several syringes in there. There were EPO syringes. There were fistula needles in there. And then there was
have you guys ever seen what a friggin' dialysis? First of all, I need to explain things. This is a fistula, okay? So this is an artery and a vein connected, and they get really strong so they can poke it with those big-ass needles. That's how they take the blood out of your body and clean it and then put it back in you, is through those big-ass, scary-ass needles. I have a needle phobia, and I have to use a bunch of lidocaine cream, and I usually take an Ativan before I go to treatment because I literally have a panic attack every time. I can't stand it. I can't look at the needles. I can't do it. But anyway, those are the needles that go into your fistula, and they have little tubes attached to them, and they go into the machine. So I get stuck with I'll put a picture up, big ass needles every time. And I have a needle phobia. This is like the worst disease to have a needle phobia. Oh my God, my eyes are so yellow, y'all. I am a little concerned about my liver. I'm so stressed. All right, let's keep going.
There's a couple that actually had blood in them where they actually pulled out when they're putting on a catheter patient, you have to pull back.
Okay, so there's a catheter you can have one in your stomach for peritoneal dialysis. Or you can end up with a catheter like I had here. I think I had one on the other side too. I don't know. I've had two. And they're just the little two tubes that come out of your chest. And I do like those. They go straight into your heart, so they're really at risk for infection. But I like that. I like having the catheter because, like, they didn't use any needles. They just, like, hook you up and then put you off. But then when I got mine taken out, I was like, I can finally take a regular shower again because you can't get it wet. Like, you have to really, wrap it and, use a detachable shower head. It's, a pain in the ass to take a shower with a catheter. Because if you get it wet, it'll get infected. And then that infection goes straight to your heart. So, anyway, there's a little lesson about dialysis for y'all. This is going to be the longest video.
Uses the blood before you hook them up to pull the heparin out.
Heparin is a blood thinner
so anyway,
that you get.
There's a couple of syringes. I went and got bleach residual
during
strips.
Treatment.
And it has a little pad on it that you actually put a solution on, and it'll change colors if there's bleach present. I tested a couple of the EPO syringes and there was no bleach present. Then I found a syringe one of the syringes that had the blood in it and tested it, and there was no bleach present. There was another syringe that actually had a needle attached to it, which was very odd and different. It had the cap on it. I removed the cap and squeezed out some of the solution that was inside that syringe on the tip of that pack, and it immediately changed to a dark purple, which is a very high positive
Yeah, they
measure of
don't
bleach.
use syringes with
So
needles.
being the person that I am, I was like, well, then I've been bleaching the
dialysis
container and it could have seeped through here. So the only other way to do it is to pull out the plunger, because nothing could have gotten inside the syringe. So I pulled the plunger out and I took this test strip, another one, and placed it inside. And
She's like a whole ass
it sold the
detective.
solution that was there. And again, it turned positive immediately with bleach as well. There was one other syringe the same way. I tested it.
We're supposed to have
and
storms, but
it was both syringe and inside positive for bleach. At this time, Linda Stevens is here with me. I had her as a witness, plus Giselle. Giselle tested several of her syringes in there. She also reported to me that she had 2 that were positive for bleach as well.
Since the day Kimberly began working at the dialysis
That was a
center,
jump
19
scare.
patients had passed away, according to the health inspector.
19?
This number was abnormally high, and an investigation had already begun, long before Kimberly had been...
Giselle, she had 2 that were positive.
This number was abnormally high. Dialysis center, 19 patients had passed away, according to the health inspector. This number was abnormally high, and an investigation had already begun, long before Kimberly had been...
like patients die at dialysis all the time. Like you're very, very, very sick, but that is a crazy amount of people to go. I think we've had like maybe 2 people in the past like 6 months, maybe, that I know of, maybe like 2 or 3, but like 19, that's freaking wild. I'm pretty sure this is a DaVita.
been caught injecting bleach into her patients.
I've been to both.
What was interesting is that all the patients that died had all been under the direct care of Kimberly.
Could you imagine dying at dialysis? Oh my God, I hate being there. Every time I come in, I'm like, sorry, I'm in a bad mood. I fucking hate it here. And they're like, oh, it's understandable. Like, I would be so pissed if I died at dialysis. Like, I don't want to be there. Like, do not make me freaking haunt this place. I literally hate it here. That sucks, dude. That literally, like, it sends shivers down my spine. That's so scary. Because that could literally be anybody. That could be any of us. Like, we have to trust these people with our lives. And I do. I love the team that I have. But, like, this administrator did a great job.
The detectives asked Kimberly to come in for an interview.
Look at this bitch.
They don't tell her what the interview is about, but Kimberly is already prepared because she knew this day was coming. Without being asked, she brings up the mortality among the patients, how she gets confused easily,
Weird.
and how the bleach is used to clean the dialysis machines.
Oh, it's
Not
really
the
good. It has
patients.
really tasty
You're not supposed to
very
clean
good.
the patients with it, lady. Frick. What the hell?
Oh, that's good.
My name is Stanley. I'm on the Grooms creative
Don't
team.
piss
We are
me
here at
off,
Muscle-
YouTube. Oh my God. I literally hit skip. Let's go ahead. Let's skip it. Let's play this video.
I don't know, these last months, I'm just scared to go to work, to be honest with you. I mean, because they can't tell
weird.
us what's going on, and I'm doing everything by the book,
Bitch.
and I'm scared because I have a
She's
license.
making me mad.
And I'm scared if I do something, then I've lost my license.
What?
You know, the
No.
anxiety in that clinic was just,
Because you're scared you're
and
going to get
I
caught.
don't know what it is. It's just, and I know we're all new, except for a couple of people.
You're the
And
problem.
I have noticed lately that there's been a lot of sloppiness.
Too much hair in here.
Ready up, and that takes a good 15 minutes, and you know who your patient is, and you know where your graft is, and you get it all ready. And the dialyzer, it has Ritalin in it, and it's got to be circulated, you know, because if they get a Ritalin infusion, well, then they're off to the hospital. You know, it's
What?
like bleach.
I don't
So,
know what Ritalin is. I've never
We
heard of
had
that.
that, and then we just had so many chest pains that I just don't.
Is that like the potassium bath? I literally don't know what Ritalin is. I get something called a potassium bath that helps get my potassium down lower every time, but I don't know what Ritalin is. I literally don't know. But the fact she even said bleach, like you have to run it after the patient is off the machine. Then you run it with bleach. She's so dumb.
understand. And they said we've had so many deaths in the past 7 months.
She said deaths is just
April.
now.
And it's just scary, and I'm scared to leave my patients. You know, I'm just constantly, are you okay? Are you okay? Are you okay? And so
She's
I'm really
making me
not
so
sure
mad.
what to do about it. I enjoy my job, and I only know I've been here 9 months, but you know, you either hate it or you like it. So, and if I can get, I have good patients that they come on, they're cheerful, they know they're here.
She wouldn't
They
like
know they're
me.
here for, you know, we're just trying to help them feel better. And it makes you feel better at the end of the day. But when you have codes after codes, it's just frustrating. And you're like, you lose your mindset of like, okay, where
I don't
am
know
I?
what that was. My whole house
Where do I
shook.
group at? So, and I really thought that dialysis was what I wanted to do.
Not
But
what I want to
what's
do.
going on. I don't know if it's in the water system. I don't know if it's in,
Have they been checking all that?
yeah, that's what they said. But I know that every day they have to do a
Confused by her.
police loop through the whole thing. And I'm just curious, what if our machines are hooked up and they have some bleach in them?
Bitch, don't piss me
I
off.
haven't researched into that, but I just have to
She's the only one bringing up bleach. I'm just going to say it. She keeps bringing it up. Like, okay.
wonder what kind of reactions would happen if there was some machines, some bleach machines, you know, not clear. I know you bleach them every week.
They need to bleach them every week.
But on Thursdays, all the machines have to be hooked up to this big bleach bottle.
It's like a jug.
They have to go through, and they have to go for like 25 minutes. And when it's done, you take your bleach bottle out of it. And to me, when I get there in the morning, if I know it's Thursdays or bleach days, so when I get there in the morning, I just check. There's a little, you know, spout thing, and you can spout it and check for chlorine, because I just don't.
You just don't think they got it out?
Well, I don't know. I just don't. I know they bleach the route of the. You might have.
Knock it off.
They bleach the loop.
Stop.
And maybe that comes all out. I don't know.
She's
I
messing
just
with
have
my
a
light.
habit of pushing the bleach because I don't know when it was last on, and I don't want to kill my patients.
Pushing bleach.
The bleach.
Yeah.
They put it in a after the patient's gone, they're in these little Tyler cylinders, and you go back to your main screen. You go
So
chemical
why were you getting it out of
bleach.
in a syringe?
And it'll go through about 35 minutes, and then you're supposed to. There's a little drain thing on the side. You're supposed to squirt it for like a couple minutes. Get your little bleach thing and make sure there's no bleach in there. You're supposed to have 2 people do it.
I always tell my techs and my nurses, like, I don't know how y'all do this job because there's so much shit to remember. And it has to do with people, like, keeping people alive. Like, you can't make a mistake. Like, they have there's so much on the machine they have to learn. There's so much, like, about, like, cleaning the machines, putting people on. Like, it's so much. Like, I really have a lot of respect for my dialysis techs and nurses because that's, like, a lot of work. I would not be very good at this job. I will just stay at the prison.
It. Just so you know there's no bleach in there.
Right.
Eggnog.
And it seems like, you know, and then it might not be my place to say, but we had 32 chairs,
Sorry, guys. She messed with my ring light.
and it doesn't seem like there's a lot of people watching. I sit by my patients because I just don't, I'm scared. I don't want my patients to go out. And it's my license on the line. You know, it's not just a PCT. You know, I have.
It appears that Kimberly knows they are onto her,
Patient
so she
care
does her
provider?
best to prove she is innocent before she can even be accused. She explains the entire process of cleaning out the dialysis machines,
Oh my God.
while maintaining she does everything by the book because she fears losing her license.
But what hurts me the most is for 2 patients to accuse me of giving another patient's medication that was not ordered. And that's been something that's really
They said
irritated
bleach, girl.
all day. I was just crying earlier, and I was like, I mean, it's my license. If I do something like that, I can't do something like that.
What did you give her antacid?
I did give her some saline, only because she said she was cramping.
But the saline is in a bag. They give you saline through your line in a bag. You don't just come over and inject saline into their line. At least I've never seen it done. I've been on dialysis for 7 years, and I've never seen it done outside of a bag. So it's like an IV bag. She's annoying.
There's
Well, hey.
saline line, Angie wasn't there. So I charted that I gave her some saline line. Her pressure didn't really go down that much.
Her blood pressure, or
And then she just said she
her
felt
blood
kind of
pressure, I guess.
nauseated.
Okay. Did you work the whole day
It could also be
yesterday?
your
No, because
pressure,
what
venous.
happened, and I'm really been upset about this, Miss Hall, she claims that I gave Miss Rome some medication. And she didn't want me to do anything to me today. And
What?
the only thing that I did was go over there and give her saline. And I know you're supposed to stay with your own 4 patients. And Angie was gone.
So maybe
And
she
she
was a
was just
nurse.
moaning and groaning. Her blood pressure was down. So I gave her a little bit of saline and I traded it. I charted it.
I thought
And
you
she
gave-
just said,
I thought she gave it to her for cramping. Now she's saying she gave it to her for blood pressure? Huh?
Miss Call said, what did you give to her? And I said, I didn't give anything to her. I gave her saline. Her blood pressure's dropping. And then it wasn't long. She had Miss Hamilton sitting right beside her. And she was like, did you see her give her something? And it was very frustrating because I wanted to go back to them too and say, what did you give? What did you see me give? Because all I did yesterday was get my patients set up, deal with the meds.
She
I
hates
didn't
her
do any
patients.
meds.
She hates her patients.
And I guess my patients, they come here and they want to be dialyzed and they want to get out.
Yeah,
And
I want to
don't
get out
know
of there
what's
as soon as
going on here.
possible.
And it's just scary.
I'm there for 3.5 hours. I'm like, let me out of here. At the end, I'm like, I'm done. I get bad migraines at the end of treatment too.
And if I'm doing something wrong, I want to know that I'm doing something wrong because I don't want to kill somebody. I mean, I know it's dialysis. It happens
Bitch.
all over the country. And I just don't understand what's going on.
What do you mean it's dialysis and happens all over the country?
Well, I guess maybe not all over the country, but there's, Amy told me the other day, she goes, girls, this is dialysis. There's so many places around here,
What?
and it goes smooth. So I wonder, what are we doing wrong?
Do you
She
really
was
want to spend the
making
rest
her
of your life
whole
watching
clinic look
ads? Guys,
terrible.
just download Pi. It's a free Google Chrome extension, and it basically blocks.
Kimberly explains that she wants to know why so many patients are dying. The detectives decide it's time to bring up the bleach. So they ask Kimberly how the bleach is used to clean the machines.
She already
Can you
told
tell
them.
us anything about the bleaching procedures?
Bleaching
Yeah, I have a-
procedures. We are supposed to, after we get our, well, some people do it before. You get your, there's 2 things in bleach back there, and it's either before or after. But you have to get your bleach bowl, and you have to get like a little medicine cup. And you gotta go all the way back there, and you gotta get that, and you pour it in your bowl.
Okay. Would there be a cause or a reason or necessity or anything like that for anyone to use a syringe to draw bleach up into?
Got her.
No,
Do you use a syringe to pour your 10 cc's of bleach up?
Sometimes I do when I can't find the little medicines cups.
Mhm.
They used to be in that trunk
She's
drawer.
making
There
me so
weren't any
mad.
in there. So I knew 10 C's will make that. But I did it at the back. I did it at the back where there was blood. Because we weren't supposed to do it up here. And you just get a little 2 ml cup, you fill it with bleach, and then you put 1,000 bleach in there, and then you put your clean clamps in there.
When you use a syringe to draw up the bleach before you make your mixture up, what happens to that syringe?
If you use a syringe, they actually have little cups to monitor them. There wasn't any cups up there that day. But if you use a syringe, 10 cc's, then you're gonna have to, put it in the receptacle.
Okay, did you do
Got her.
that yesterday at all? Did you draw any bleach up in a syringe?
I drew, I had 2 that I went back there for.
You used a syringe with the bleach in there?
With your water.
With my water?
Yeah.
You mean on the clean bleach? No.
Yeah.
Mm-hmm.
See, I didn't have those 2 mLs. So I went to the back and I got a 10 cc syringe because I couldn't find any more of those little yellow things. And I pulled up my 10 cc syringe and I dumped it out. And I discarded the 10 cc syringe because we were out of those little cuppy things.
How many different syringes did you use? Did you use one for both solutions, or, you know what I'm saying? Did you draw your bleach up, put it in the solution, draw more bleach up in the same syringe, and put it in your cleaning cup?
No, I had 2.
Were you near any patients when all this happened?
They were on the machines.
Did you ever go over to any patients with any syringes in your hands?
The saline.
While you were adjusting the saline over there, just checking on them or anything like that, did you ever have any syringes in your hand or?
No, because I wasn't doing meds that day.
We're all trying to figure out, why there's been this sudden spike in events, over the past month or so. Do you have any theories or any ideas what's causing all this?
Well, I know I'm new. I've only been here 8 months. But I just wonder about the blood pressures, when they come in and they're really high. I get so scared they're going to stroke out. It's just scary. I didn't know dialysis was going to be like this. The first few weeks, it seemed to go okay. You might have a bleeder or 2, but having triage every day is just, I keep going over and over in my head, my books, and trying to figure out what have I done wrong.
What the fuck
Of the
you
5
think, lady?
patients who had died over the previous month, prosecution was able to prove that Kimberly had direct
5 patients in 1 month is insane. Even for a dialysis clinic, that's crazy. I've never seen more than 1 patient pass in like a month. Like 5 that's so crazy. Like no wonder. Like I'm glad she got caught. She was just killing everybody. Fucking bitch. That makes me so mad. I literally I hate dialysis already, and this just scares me. That and then the guy whose lines came unplugged and they didn't know it and he bled out all onto the floor. Yeah. One time my catheter got twisted with a clamp. He was trying to clamp my line shut because I just finished treatment and it was twisted so it didn't clamp. And there was just blood gushing out everywhere. And he's like, I can't get it clamped. It scared him too. He's like, yeah, that scared me too. It was my nurse. I felt so sick. I was like, oh my God, I'm going to bleed to death. I literally was like, this is how I'm going to go. It was so scary. Like I said, my nurse was even scared. He was like, oh my God, I almost didn't get your line closed because somehow it got twisted in the clamp. I was like, oh my God. It was the worst. I've had other things happen. Like I bleed real bad out of my arm after the end of treatment. Sometimes they can't get it to stop. So that's always really scary. But this is like my biggest fear, honestly.
Contact with all of them. They also showed the jury that Kimberly had Googled bleach poisoning and whether or not bleach could be detected in dialysis lines. This evidence, along with the co-worker's testimony stating that Kimberly hated her job and was very aggressive towards her patients, was enough for the jury to convict her of 5 counts of murder.
Literally, I've had nurses like that before, and I've actually like lipped the fuck off to them too, and then I got in trouble. But like, you can't be like that towards me, man. I fucking hate it here. You're not gonna make it worse. Like, I'm a very nice person. I'm a very nice patient. I'm an easy patient. I do freak out a little bit over the needles, but they know that about me. But yeah, I've had some, I don't know, I guess she was more of a tech, but like, yeah, I've gone into it with a couple of you. You can just tell the people who hate their job and the people who actually like care about being there and why they're there and helping us. Like you can just tell when someone hates being a dialysis nurse or tech, and it's really unfortunate because we don't like doing this either. We don't want to be here either. Like, I'm sorry that being here helping us stay alive is making you so miserable, but like, at least you're not on our end of it. You know, at least you're getting fucking paid to sit here and do stuff. Like, I don't get paid. I live on $900 a month in disability, and that's it. Like, so maybe don't take it out on us. Like, we didn't, like, you choose to work here. We have to be here. So go get another job. They'll find someone to replace you who actually likes helping us.
Kimberly was sentenced to life in prison without the possibility of parole.
You've never given an interview. You didn't testify in your trial. People who know about your case will have ever heard you speak, really. Why are you doing this?
There's just a lot of things that was never said, and I believe it's time to speak.
I work in the men's prison, but at the women's prison, they can't have makeup. So, are her eyebrows tattooed on? And her eyeliner, because you're not supposed to have makeup in prison, lady.
Speak out. I found myself working at a dialysis clinic that was more about money than they were about the lives of their patients. I was falsely accused of something, and that's why I'm here today. I know that I didn't do anything that would have done anything to harm another patient.
This wasn't going on before you got there, and it hasn't gone on since you left. I mean, the chances of one patient dying of cardiac arrest, about 7 in 100,000, but the odds of 2 patients dying that close to each other was described as astronomical.
Well, and I would probably agree if I knew the statistics.
But why do you think it was all happening once you joined?
Well, no, I never put 2 and 2 together like that.
But it came up in court that you told staff you didn't like the patients which you had been charged with helping.
That's silly. I would never say something like that.
But why would these 2 patients invent the fact they'd seen?
I don't like Pierce Morgan, but I do like that he's like, got him with her right now.
Well, first of all, neither one of them could see. Did draw it up, but I was making it for a cleaning solution. I wasn't making it to go kill somebody.
But they're all lying, all these people.
Yes.
But why would you be asking, can bleach be detected in dialysis lines?
I've always thought it was the water system. I do know that the water treatment system, how it wasn't cleaning all the chlorine out of the lines.
It's either the water, which nobody believes apart from you and a few people, or it's you, only person that could possibly have been, because you were the only one around these machines in every single case, was you.
That's not true.
And the common theme of all of it, in the end, is you.
She's making
Why
me
did you
mad.
do it?
I didn't. And why would I? I had nothing against any of those people.
Sometimes the easier thing is just to admit it. That's the path to atonement. And maybe you're in denial to yourself. You and I know you did this.
No, I did not. That don't even make sense.
It does make sense.
I really thought you were going to help me.
Help you what?
Help me to get the truth out. Thanks a lot.
I think we did get the truth out.
I guess he got in your pockets too.
I just think you're guilty. I'm sorry.
Okay. Guilty for killing people for no reason. That makes a lot of sense.
It doesn't make any sense.
Some investigators believe that Kimberly killed over 15 patients during her time at the dialysis center. However, this isn't the first medical facility she has worked for. Kimberly had been fired by previous employers, who stated in her termination letters that she was not to be rehired under any circumstances. What are your thoughts on this case?
Holy cow.
Why do you think Kimberly went on a killing spree?
I think she hated the dialysis patients, which happens because they see us as, I've heard people call us parasites before. I've heard people say dialysis patients never follow their, like they're always non-compliant. They're never doing what they're supposed to do. They just want like drugs or whatever, which like, I don't even get anything like good. What? There's just like, I think after you work there for so long, you might like develop some kind of prejudice towards dialysis patients, because honestly, there are a lot of people who are so fucking annoying and unhygienic and like legitimately don't do what they're supposed to and are fluid overloaded all the time and eating what they're not supposed to eat and not coming to treatments and all this kind of stuff. So like, I do understand how people can get kind of tired of that, but not even like 5% of people on dialysis are like that. It's just like a few people. And I think she just was bitter and hated her job, and she ended up being resentful of the patients for whatever reason and decided that whatever she was going through in her life, she was going to take it out on these vulnerable, frail patients who couldn't fight back, who couldn't, like didn't know necessarily what was going on. She probably picked people who weren't as cognizant of what was going on, and she took out whatever she was going through on them. That's what I think. Anyway, I hope that I never end up dying at dialysis, because I freaking hate it there. Like, let me at least make it home so I can die in my nice bedroom. Like, oh my God, guys, I feel like crap. I have dialysis tomorrow, and I'm just going to be like, anxious. Be like, hey, none of you guys have bleach syringes, do you? They'll be like, Keely, shush. They're like, no. I do kind of maybe get on their nerves a little bit, but it's all in good fun. All right, guys, well, that was the video for today. That was very anxiety producing for me, but I did want to see that interrogation, because I've heard about this for a long time, but I never really got to like see the interrogation. So she's just as much of a dumb bitch as I thought she would be. Yeah. Anyway. Okay, guys. Well, leave in the comments what you want me to watch next. I'll do some music reactions sometime this week. I'm still recovering from the hospital. I'm like really struggling. Like, I'm not doing good. So yeah, but leave your suggestions for me. It could be music. It could be something scary. It could be really anything. I'll really watch anything. So yeah. And other than that, I will just see you guys in my next video. Okay. Love you. Bye.